Dr. Bobby, every time we have a patient come out here, it amazes me there's something new and there's different. Tell our audience your name.
My name is Janice Boucher, and I'm a recovery room nurse at a local hospital here. And I take care of some of Dr. Bobby's patients,
Yes,
and other patients too.
But I understand that you actually saw the patients come out of the surgical room. For you, it was 100 actually patients before you decided to do this yourself.
Right, yes.
And how much weight were you looking to lose?
I was looking to lose about 100 pounds, but...
And how much did you weigh before?
Well, I weighed 270 on the day of surgery, so I lost 140.
So you see, you know, a lot of patients, they come in here, you know, and they're under sedation. They don't actually see what happens. They see the end result, and they're happy with it. You actually help the patients, you know, and see them before they go into surgery, and then afterwards, you're with them too. You know exactly what kind of surgeon Dr. Bobby is, right?
I watched him for a while before I let him do surgery on me, but, you know, I watched and I knew how good he was, so.
So how is your life today?
My life is fabulous.
Yeah?
First and foremost, my health has improved.
Yes. Like you're off what kind of medication?
Well, I wasn't on any medication, but I should have been.
Yes.
And my blood pressure was very high. My triglycerides, all the fatty tests that I had done were all out of whack. I had difficulty, you know, walking long distance. I got really short of breath, and now I go hiking up in, you know, the mountains.
Well, congratulations.
And to be honest, I mean, you know, I've been dating quite a bit.
Yeah,
so.
You know, that's what I see. You know, when people are obese and they've tried every way to lose the weight, when they have this gastric bypass surgery, their life changes dramatically, health-wise. It changes in their social, you know, network. It changes every which way.
It changes your whole outlook on life too. You know, I think when people are morbidly obese, you kind of stay in the house.
Yeah.
You don't want to go out because you're always, you know, people are looking at me because I'm so big.
Yeah.
And now it's nothing. You know, you throw on shorts and a t-shirt and you run down to the store, and, you know, you're not having to worry about wearing sweaters or coats to kind of hide, you know, what you don't want people to see anymore.
How long ago did you have your surgery?
2 years and 2 months ago.
Wow. You know, you more than almost every other client or patient that's come in here have a lot more self-confidence. And I think that's probably due to the fact that you were working in this field anyway, right?
Exactly.
Yeah. There is a support group for people after they've had their surgery?
Absolutely, and that's probably one of the most important factors after surgery. Like I said, surgery is only a tool.
Yes.
The support group is what actually gets a lot of these patients motivated to keep doing what they're doing.
Well, thanks for being on the show.
Well, thank you.
My hat's off to you. And thanks for helping other people and getting this message out. And we're going to have some more patients on here to say that what their story is. Thank you.
Thank you.
Good
Thank you, Dr. Bobby.
Your next guest, Crystal. I saw a picture of you, Crystal, before we even started this show, and you don't even look like the same person.
Thank you.
How much weight did you lose?
For my largest, I have lost 101 pounds.
101 pounds. And how long ago was that?
I had my surgery in July of '06.
Wow, that is tremendous. How has it changed your life?
I have a lot more self-esteem, self-confidence.
Yes.
I look at the world differently now. I go out, instead of being in the shadows, I make myself known. I let people know that I'm there. I'm not scared anymore.
I understand you're pursuing a new career.
Yes, that's
You're
true.
going to become a nurse,
A registered nurse, yes.
Yeah, these were things that you ever thought possible for you to do before?
I thought about them, but because of my size, I knew that it would stop me from doing some of the things that they need to do.
Right. You told me something interesting, and you're a beautiful woman. You told me that before, when men looked at you, you thought they were looking for the wrong reasons. Now you wonder why they're looking at you, because you had this transformation, right?
Yes.
You remember when she walked in that first day, Dr. Bobby? And look at her today. Just totally, it's amazing. I mean, it's totally amazing.
Absolutely.
Yeah, it's kind of like you see the real you. Now, Crystal had a little bit different type of operation. She
That's
didn't have a
correct.
gastric bypass. She had a lap band, right?
That's correct.
I feel full on very small amounts of food, and it's very satisfying.
Now, you've also changed the type of food you eat, too,
Yes,
though, right?
I have to watch what I eat so that I get the nutritional intake that I need for my body to stay
So
healthy.
what kind of foods do you eat these days?
I eat stuff that's high in protein, high in vitamins and nutrients, a lot of liquid to stay hydrated. I don't eat junk anymore. It's basically what it is. I eat the stuff that I need.
That's amazing, you know, and the most important thing, we see this over and over again, is after a person has whatever kind of surgery, they have this discipline that they have to acquire so they can maintain their health. Your health has improved?
Very much so.
What are some of the differences today?
I had hypertension. I no longer have it. I had GERD. I no longer suffer from it. I had knee pain, hip pain, and I don't suffer from those either.
Wow. Well, listen, congratulations. Keep up the
Thank
good
you.
work.
Thank you.
You look great.
Thank
Men
you.
are looking at you because you're pretty, okay? And someday we'll have you back again.
All right, thank you
Thank
very
you for
much.
coming.